Over the last few years, artificial intelligence has moved incredibly fast. What once felt like science fiction is now being used by real companies to cut costs, automate tasks, and shrink teams. If you've been paying attention, you've probably noticed something unsettling. Jobs that once felt safe suddenly don't feel that way anymore. This video isn't meant to scare you, it's meant to be honest. Because while this new technology will replace certain types of work, there are entire careers it simply cannot replace, and understanding why matters more now than ever. The first thing to understand is this: artificial intelligence doesn't replace people. It replaces tasks, specifically tasks that are digital, repetitive, rule-based, and done entirely on a screen. That's why we're seeing disruption in areas like customer support, data entry, content moderation, basic analysis, and even some technical roles. If a job can be reduced to patterns, inputs, and outputs, many companies can often do it faster and cheaper. This doesn't mean the people in those roles lack skill or intelligence. It means the environment of that work makes it easy to automate. And that brings us to the most important question of all. What can't artificial intelligence replace? Anything that requires physical presence, human trust, and real-time accountability. That's the barrier it can't cross. You can't automate hands-on care, human judgment in unpredictable situations, ethical responsibility, or real human connection. And this is where careers like healthcare stand apart. In medicine, nursing, and allied health, the job doesn't live entirely on a screen. It lives in rooms, in conversations, in decisions made with real consequences. Technology can assist, but it can't replace the person in the room. Healthcare isn't just about knowledge, it's about presence. Patients don't just need information, they need reassurance, assessment, compassion, and someone accountable when things go wrong. That's why even as hospitals adopt new systems, electronic records, and diagnostic tools, they still require nurses, technicians, assistants, and clinicians to be physically there. However, it can help chart faster, flag risks, and suggest possibilities. But it can't perform bedside care, replace clinical judgment, or take responsibility for outcomes. In healthcare, it removes friction, but it doesn't remove the human. This is an important distinction. The future of work isn't humans versus artificial intelligence. It's humans working with it to be more efficient overall. In healthcare currently, it's already helping reduce burnout, improve accuracy, and streamline systems, not eliminate roles. That's why medical careers remain some of the most resilient paths in an increasingly automated world. This is also why platforms like MedCourse exist, not to push people into a career overnight, but to give them a way to explore medical paths, certifications, and options at their own pace. Because for many people, the hardest part isn't learning. It's knowing where to start. Choosing an artificial intelligence-resistant career doesn't mean rejecting technology. It means using it intelligently. It doesn't mean quitting your job tomorrow. It means building options. Healthcare offers entry points at many levels, roles that are respected, needed, and grounded in human interaction. And as technology continues to advance, those human-centered skills become more valuable, not less. If you're curious about where your career fits in an artificial intelligence-driven world, MedCourse is there as a resource. Whether that's today, next year, or just something you explore quietly on your own. Because real security doesn't come from ignoring change. It comes from understanding it. and preparing wisely.